Children 6 months and older are now eligible for the COVID-19 vaccine. On this episode, hear from our public health expert and local parents as we discuss this new age group and the protection from the virus.
Whether you live in or just love Johnson County, Kansas, JoCo on the Go has everything Johnson County. Here's what's happening and what's coming up in the community you call home.
Thanks for joining us for JoCo on the Go. I'm your host, Teresa Freed, a Johnson County resident and employee of Johnson County government. In June, federal public health officials authorized emergency use of COVID-19 vaccines for some of our youngest residents, and parents are now taking advantage of this extra layer of protection for their little ones. Here to talk more about that is Johnson County Department of Health and Environment Director, Dr. Sanmi Areola. Thanks for joining us.
Thank you for having me, Teresa.
All right. Well, it's taken, it seems like a while to kind of get to this point, but young children are now getting vaccinated. So can you talk about all that work and research that went into getting to this point?
One of the things that we have been looking forward to is to find a way to protect our youngest residents. And this has been in the works for a while, obviously since late 2020. When we had our first set of vaccines. The vaccines have been by far the most important tool in our fight against the serious consequences of infection of the virus that causes COVID-19. And we have done a good job in our county vaccinating older residents, having vaccination rates really way higher than the state average and higher than the national average, having the highest vaccination rates in the state. However, we have been until now been unable to get approval for vaccines for those that are 5 or younger. And so it's exciting times. It's a really good development that the FDA and the CDC and the advisory councils approve these vaccines. Now we have that tool available to us for our residents who are 6 months to 4-year-olds who can be protected, and the parents can feel more comfortable when they send them to camps in the summer months. They can feel more comfortable when they send them to childcare settings, because what we continue to know about the vaccine is that they remain robust, incredibly efficient in protecting us against the severe consequences of infections from the virus that causes COVID-19. So these are exciting times, I think.
All right. So I think I'm a kind of a perfect example of our typical parents and some of the concerns that they have. So, I've got 3 kids now. I've got a 10-year-old, a 4-year-old, and a newborn. So my 10-year-old is vaccinated and my 4-year-old is now eligible. And so my baby is not quite eligible still. So we're thinking about getting our 4-year-old vaccinated. So kind of sell it to me. What do parents need to know about the safety of this vaccine?
So the process for getting vaccines to the market is pretty well defined. We're not just looking at the efficacy, in which case, because we've given this to millions of people 5 years and older in the country and across the world, we're also looking at the safety. So all of those are evaluated robustly through clinical trials and ongoing safety monitoring. And so these are really some of the more stringent processes around the world that we have in the United States. So these vaccines, right now, we've given it to hundreds of millions of people. They continue to prove very effective. We continue to do safety monitoring, and it's really pretty clear that the benefits in terms of reducing the risk associated with infections of the virus that causes COVID-19 compared to the extremely low risk of some of the rare things that could happen from the vaccine, the benefits by far outweigh the risk. And so the recommendation, obviously, we're always telling parents to consult with your pediatrician. That's where you get your other vaccines from. If you have questions, they'll be very happy to answer them, but there's no We don't typically get opportunity to have this many people get the vaccine over a short period of time that allow us to not only prove the efficacy, but prove the safety. And we have a lot of data for that.
And so the dosing itself, that's adjusted for these smaller children, I would assume. Do they also follow that same sort of schedule where you get the first vaccine and then you follow up a few weeks later and get that second shot?
Yeah, so we have two types of vaccines here. We have the vaccine from Pfizer, BioNTech, for those that are 6 months to 4-year-olds, which is a 3-dose primary series. And then for 5 to 17-year-olds is a 2-dose primary series. But we also have the Moderna, which is for 6 months to 4-year-olds. It's a 2-dose primary series. And for 5 to 14-year-olds, it's also a 2-dose primary series. Now for the Pfizer, for those that are 5 years and older, the 2-dose primary series are given 3 to 8 weeks apart. Of course, if you are moderately or severely immunocompromised or have a weakened immune system, you should get a third dose about 4 weeks after the second dose of the primary series. For those that are 6 months to 4-year-olds, it's a 3-dose series, like I've said. The first 2 doses are separated by 3 to 8 weeks. The second and third doses are separated by 8 weeks, at least 8 weeks. So again, that's for the Pfizer. The Moderna that I said is a 2-dose series, and the 2-dose primary series. For those that are 18 years or older, we want the first 2 doses to be given 4 to 8 weeks apart. People with that are moderately or severely immunocompromised or have weakened immune system should get a third dose, and that the first 2 doses for them should be separated by 4 weeks, and the second and third doses separated by at least 4 weeks. For children 6 months to 17 years of age, it's also a 2-dose Moderna series that are given 4 to 8 weeks apart. Again, for those that are moderately to severely immunocompromised or have weakened immune system, they should get a third dose with the first 2 doses separated by 4 weeks and the second and third doses separated by at least 4 weeks. Fairly complicated, much more complicated than before, which is why you can consult with us or consult with your primary care physician to ensure that based on your age, you have the right separation, and based on your medical condition, you're getting the right number of doses.
That makes sense. And I know that we're encouraging parents to take their children to their pediatricians to get those COVID-19 vaccines, but we are starting to see people come through the JCDHE clinics as well. And so we did get a chance to catch up with some parents who were getting their young children vaccinated, and here's what they had to say.
I am a healthcare professional, and so I didn't have to work nearly in the ICUs during the major surge of the pandemic, but I had a lot of friends that did, and I just think it's very important that we all play our part, and part of getting back to normal life is getting them vaccinated. So she gets all her other vaccines. They were really smooth. It was fast and quick and easy, really professional, had a great flow to the day. I would recommend doing your research and making sure that you feel confident in your choices, but also making sure that you're getting accurate information is vital. So utilizing your public health, those different organizations, your national organizations, to get information about the vaccine is very important. But I would also really encourage getting it. It's helping them get back to their normal life, and it's another thing that we can do to just protect each other.
I have an almost 2-year-old and an almost 4-year-old.
And why did you decide to get them the COVID-19 vaccine?
Because I want to help protect them. I got my shots last year, and we've been waiting to help get them the protection that they need so they can go out and live their own lives too.
And what would you tell other parents who are kind of on the fence about getting vaccinated?
It's a big decision, but it's the right decision to help protect your kids and other kids too. There's kids that truly can't get vaccinated, so we need to help protect them and help protect your own children from severe disease or lifelong complications of getting COVID. I definitely feel that the vaccine is, the risk and the benefit. The benefits definitely outweigh the risk of it.
My next question is, we tend to hear that young children tend to experience more mild symptoms. They're not seeing the same rate of hospitalizations as older adults and, middle-aged residents. So why should people get their children vaccinated?
Excellent question. Children, and we have seen several cases, have been hospitalized and they have gotten really sick from infections from the virus that causes COVID-19. And unfortunately, some have died. And so, as I've said before, the vaccination has proven over time to protect against the more serious illnesses caused by the virus. It protects against hospitalization and robustly protects against death. Children also do get very sick from COVID-19. They have both short and long-term effects. They are also able to spread COVID-19 to others. We have seen cases of MIS-C, what's a multi-system inflammatory syndrome in children. We see a lot more of that in children ages 5 to 11-year-olds. We see a lot of much higher, greater than 90% of those occurring in children that are not vaccinated. So again, while children may not be as susceptible as older adults, especially those with weakened immune system or immunocompromised, children have been sick, children have been hospitalized, and children have died from COVID-19. Having this vaccine that have been shown to be very effective and shown to be very safe is a big tool at our disposal now to minimize the impact of things that we still don't know about the COVID. We talk about long COVID. The long-term consequences are not completely well elucidated or completely understood. So we know the vaccines work. Get your child protected, so you have peace of mind when they are participating in activities, when they're in schools, and when they're in childcare settings.
And so I know there is a long list of variants since we originally first heard about COVID-19. So the vaccines that they're developing, are they constantly changing that, I guess, formula so that it can adapt to those new variants?
So right now, there is a conversation and there's work going on to look into a formulation that could be more targeted towards the circulating Omicron and the subvariants. But the vaccine that we have now continue to elicit very robust antibody response in the body and continues to be very effective in protecting us against severe illnesses and hospitalizations and deaths. But we're continuing to work, scientists are continuing to look for ways to improve the effectiveness against emerging variants and subvariants.
So are the new variants that we're seeing emerge, are they weaker than the original one? Or because it seems like, I've had COVID twice now. The original COVID, which resulted in me having some long hauler symptoms of the altered sense of taste and smell. I got it again in February when I was pregnant, and that was scary too, but it didn't hit me quite as hard, it seems like. And, I know you're not a medical doctor to speak to my symptoms and things like that, but if you can talk about, what are we seeing with these variants?
Right. So we haven't seen a big change in terms of the variants causing more severe illnesses. We have seen changes in terms of the variants being more infectious. Early on, you mentioned loss of taste. That was more common with the wild type, the original variant that we saw. That does not seem to be quite a common symptoms with the Omicron species, but largely most of the symptoms remain the same. The other factor, though, is that you are vaccinated and people are vaccinated, and which lessens the severity of the symptoms for the most part. Most people either have no symptoms or have very mild symptoms. but it's also true that you gain some natural immunity, albeit it wanes over time from infection. So all of those are working to our advantage. Having a high vaccination rate, having quite a lot of us have been infected or reinfected over time, and those do profile some advantages in terms of minimizing the severity of the symptoms that we see.
And I know this is a question we ask all the time, and we never really have a full answer because we can't predict the future. But is COVID something that's going to just always be with us, or is it something that you foresee us eventually saying goodbye to?
The COVID virus is here. I think the general consensus is it's going to be with us, and we have more tools, we have more resources. We've got, of course, the vaccine. We've got monoclonal antibodies. We have pre-infection tools, post-infection tools that we can use to minimize the severity. There are additional tweaks that's ongoing on with the vaccines that's available. And given the decisions that we have made as a society and as a community, given the fact that outside of vaccination and individual choices as to whether you wear a mask and where you go, given the fact that we actually have resumed life the way we used to live it pre-COVID, it is harder to see a path towards eliminating the virus. But again, the good news is we have more tools, and we can clearly see a path towards minimizing the more severe illnesses and the more adverse consequences of the virus. Again, some of what we don't know are the long-term consequences of infection. So we continue to study those as we move forward.
All right, and just back to the topic at hand, talking about these younger children who are now eligible for the COVID-19 vaccine. How can parents get their kids vaccinated? We've reiterated that the pediatrician is probably the best place to go to get that, but how does somebody get the vaccine?
Our primary recommendation is to go get the vaccines where you get your other vaccines from. It is best to go to your pediatrician to do that. Of course, we have our clinics open. You can come to our clinics, but again, given the younger population and what it takes to vaccinate, mass vaccination clinic is not equipped to handle many or high throughput like we did for adults. So, and again, just like we did at the start of the pandemic, where we were giving out vaccines at our clinics, but we were also working with our health systems, our hospitals, to give out the vaccine, which I believe is part of why we got to the high vaccination rate as a county, because people already have relationships with their doctors. They already have relationships with their pediatricians. The pediatricians are best positioned to answer questions that you may have. They have the full history of your child. Still, that is our primary recommendation. Go to your pediatrician. Of course, pharmacists also have. Some of them maybe are still trying to develop the resources to vaccinate this age group. But unlike when we started, there's just a lot more options for you to get the vaccine. My primary recommendation is go to your pediatrician. That's the best route to take.
All right, that sounds good. And of course, you can always get much more information about how to get those vaccines and testing kits and all kinds of great information about COVID-19 in Johnson County by going to our website at jocogov.org/coronavirus. Again, thank you for being here with all this great information. I know the conversation will continue as the virus continues to be present in our community, and hopefully someday we can say goodbye to it. We're just not there yet, right?
We're not quite there yet, but thank you for the time, Theresa.
You just heard JoCo on the go. Join us next time for more Everything Johnson County. Have a topic you want to discuss? We want to hear from you. Follow us on Facebook and Twitter at JoCo Gov. For more on this podcast, visit jocogov.org/podcast. Thanks for listening.